What is immunotherapy?
Historically, cancer cells have had the ability to disguise themselves or make themselves invisible to our immunity, and that's why immunity is not able to catch them.
और tamoxifen के side effects क्या होते हैं डॉक्टर?
The benefit that I am getting in terms of not allowing a cancer to come back and ensuring that you live healthily till 85 to 90 years of age is so much. It's a way of just mollycoddling them. I tell them, see, इतना side effect हो रहा है, इसका मतलब आप में गोली बहुत अच्छा काम कर रही है.
I want to remind you that you did not use the word cancer even once during the conversation.
The truth can be soft.
Yeah.
So I prefer to use the word tumor rather than a cancer. Women who live in Mumbai, Calcutta, Delhi will have probably a risk in 1 in 18 to 1 in 20. In India, the lifetime risk of getting breast cancer is 1 in 25 women. A smile on somebody's face, I'm telling you, it's worth it.
A lot of you know that I battled breast cancer in the year 2022. And I shared most of my experiences and my journey on social media. I was applauded a lot for being brave, so to speak. But I think when you're faced with adversity, there are only two options you have. या तो आप give up कर दो, या तो आप fight back करो. And I think if the adversity involves a life threat, then everybody has just one option, and that is to fight back. I think the only difference is that I did it with a smile on my face. And the reason why I did that, a big reason why I did that is because of my doctor, Dr. Mandar Nadkarni, who's here in the studio with me today. He gave me the assurance that everything is going to be all right, and that is all that I needed. So we're going to be talking to him about my journey and about breast cancer today. Hi guys, I'm Chhavi Mittal. Welcome to Silver Linings podcast. So doctor.
Hi.
Hi. Thank you. एक तो आप आज खुद भी बीमार हो.
A little bit under the weather, yes.
And you were just telling me that today you took a day off.
Yes, I did. Because in the morning when I'm fine now, but yes, in the morning I was really bad.
So I didn't know कि doctors भी ऐसे छुट्टी ले सकते हैं. How often is it that you actually end up taking a छुट्टी?
I mean, see, a virus is a virus, right? It does not discriminate between me, you, or anybody.
Yeah.
So I do tend to push myself. So normally if I catch a viral, I do tend to medicate myself and work, because generally, my appointments are lined up almost 2 months earlier, and it's unfair. But sometimes you are really down. Like today, I just couldn't get out of bed. Body ache, 102 fever. I tried and sat up, but then I think I gave up after some time. Then I called them, cancel everything, I'm at home.
But that must be like so much responsibility on your head.
No, but it's going to be rescheduled. I'll have to work a little bit more over the next 3-4 days, and I'll catch up.
Okay. I remember that मैंने जब अपनी बायोप्सी करवाई थी, पहले तो मुझे ये बताओ कि जब मैं फर्स्ट टाइम आपके पास आई थी and when you checked me and this was before the biopsy, how do you come to know? I mean, I have 3 lumps in my breast. I had 3 lumps in my breast. You just know which one is cancerous and which one is not, and which one needs a biopsy and which one doesn't. How does that work?
So it is, okay, let us be very clear about one thing. The only proof, because this is an educational program that you are running, the only proof whether a lump is cancerous or not is biopsy. Okay? But what happens is now 22 years I'm in the same field looking at the same thing again and again and again. So our brain has the ability to rationalize, to learn over a period of time. Okay, in the initial part of your career, you tend to make mistakes. You think, oh, I think this is a cancer, then the biopsy comes non-cancerous. Okay. Sometimes you think this is not a cancer, but the biopsy comes positive. But as time passes, you get fine-tuned. Your judgment starts getting better. And that is where you start actually putting your money where your mouth is. And you say that, okay, I think I'm reasonably certain. I mean, you come to a point where you start using these kinds of words also. I'm reasonably certain that this lump is suspicious, and the other two, I promise you don't have anything to worry about. Having said that, one should not be very egoistic. Then you look at the imaging findings on the mammo, or sometimes sonography, sometimes MR if it is required. And if there is even 1% of doubt out there, so I think it is non-cancerous, but my sonologist says, boss, I'm not very sure, put a needle and do a biopsy. At the end of the day, it is the patient's life that is important. So ego doesn't play a role here at all. But over a period of time, we do get a feel. 99.9 out of 100 times we are correct.
So, I mean, is it also possible to self-diagnose?
Yes, of course. That is the reason why breast self examination has been taught.
Hmm.
Okay, so that is why it is recommended that all women start doing an examination once a month. Again, one should understand once a month. Sometimes I have asked people, including doctors, do you do self examination? And then they say, yeah, every day when I take a shower, I check myself. That doesn't work. Okay,
Acha, why is that?
Very simple. I've got two big kids now, but say once upon a time, this is an old thing that I used to tell all my patients. So when they were small, I used to say, both my bachas are small. I go home and I look at them every day, and I can't make out who's getting fatter and who's getting taller. But say their grandmother sees them after about a month or one and a half
Okay.
months, and she said, this guy has become taller and this guy has become fatter. So I
Okay.
will. So if you check the lump or the thing every day, you'll say, no, this was there yesterday. This is not something new. So you have
Hmm.
to check yourself after a reasonable gap of time, and
Hmm.
this reasonable gap of time has been defined as 1 month. So don't do it daily, don't do it weekly, don't do it fortnightly, don't do it once in 1.5 months. Do it once a month. And for young women who are still in the middle of their menstrual cycles, the recommended time is that you do a self examination about 3 to 4 days after your period ends, which is when the breast is going to be the least tender, soft, and if there is any lump, God forbid, you're going to be able to pick it up easy
3 to 4 days before the period.
after the
After the
period
periods.
ends,
Okay.
is what you do.
Okay.
Point one. The second thing, all again, women should understand when we recommend breast self examination is that you start at the age of 20. Now, who gets a cancer at 20? Practically, what is the chance? I have treated only two patients who are under 20 years of age in 20 years of my life.
Hmm.
Okay, so nobody really gets it. Then why start at 20? Because it takes time for your hand to get accustomed to examining yourself.
Hmm.
So by the time you reach 30, 35, 40, 45 is when, God forbid, if you get a cancer, you are an expert at examining yourself and you're going to catch it very fast. So you have to start at 20. You should not start at 40, 41, and 42. So that's one point. The second thing that one should understand, and is a point I would really want to stress upon, is every single time a lump is felt, one has to imagine the mirror image on the other side. Okay, and if a similar lump exists there, then this is probably the way God has made you. That's not something that you should worry about.
Okay.
Point one. Second point, if you have a lump like that, remember 9 out of 10 times it's never a cancer.
Hmm.
So don't feel afraid to go and show somebody if you find something abnormal, because what happens, a lady jab quite often feels it and then says, oh my God, I think I have a cancer, and now she sits on it. Takleef nahi de raha, I don't want to open the Pandora's box. I don't want to go and meet a doctor.
नहीं, वो ऐसा होता है कि ऐसा मतलब बहुत लोग ऐसा बोलते हैं कि आप डॉक्टर की क्लिनिक में जाओगे तो यू विल कम बैक अ मरीज, तो उनको लगता है अगर मैं नहीं जाऊंगी तो कैंसर नहीं होगा,
It's
मैं
like
चली जाऊंगी तो या
close your eyes and
ऑस्ट्रिच
pretend ostrich and
या
pretend the problem doesn't exist. But one of the reasons is because when they examine, they feel now this is a cancer. So my earnest request to everybody out there is, please remember, only 1 out of 10 will be cancer. 9 out of 10 will 9 out of 10 times it won't be a cancer. So you go to your doctor is probably going to tell you this is not a cancer, and you are relieved. At least every single night you are not in the middle of the night touching and seeing what's happening to the lump.
करेक्ट
It's all gone. So that's
करेक्ट
what you should do.
एंड would you like to also talk about my cancer stages and why did you feel that my case is absolutely curable?
Now everybody feels that cancer is cancer. Okay, that all cancers are going to behave the same way. Um, Cancers also have different types.
Hmm.
Firstly, the outcome of different cancers depends on what organs they also come in. So,
Okay.
like breast cancer, thyroid cancer are some of the best. A few blood cancers like lymphoma are some of the best performers. And the worst performers are, say, lung cancer, esophageal cancer, pancreatic cancers. So, one is where it comes from. So, the moment, fortunately for me, I treat breast and colorectal cancer, and both these cancers have a very good outcome. So, more often than not, I have only good news to give my patients.
Okay.
Okay, point one. But now look at breast. Breast is one of the best in terms of your cancer outcomes. Now within breast, we have a few different types. All cancers are not the same. So we have something called as luminal A's, we have luminal B's, we have triple negatives, basal one, we have HER2 positives, and each one of them behave distinctively. The best are the luminal A's, then the luminal B's, then the HER2s, and then the basal or the triple negatives. Again, I would like to say, when people say basal or triple negatives, there is a general thought of feeling that, oh my God, I have a triple negative, all is over. No.
Okay.
Stage for stage, the difference in outcome may be about 4-5%, not more than that. So triple negative does reduce your overall cure rate by about 3-4%, but it's not like if your otherwise cure would have been 90%, now it's become 40%. No, it's around 50, 86, 85%,
Okay.
which is something that one should very happily accept and just treat yourself well. But the best is luminal A. And when I first saw you, firstly, though, you had picked up a tumor that was this tiny.
Okay.
So it's stage 1. Okay, so you're starting with a stage 1. The next thing we look at, has it gone to your lymph nodes in the armpit? No lymph node in the armpit. So we are looking at a stage 1A. Can't get any better than that. So if it's lesser than that, it's not cancer. You're stage 0. So you were absolutely on the most favorable end of the spectrum when it came to the stage of the cancer. Now we got a biopsy done, and the biopsy says that it's a tubular or a grade 1 cancer. It's 0.8 centimeters. It's strongly hormone driven, and it's MIB1 as we call it. Is only 8 to 10%. 8 to 10%. A MIB1 means if a tumor were to take a selfie, okay, how many cells are active and how many are sleeping at any point in time. So out of every 100 cells, in your case, 8 to 10 are active. Rest all
Okay.
are sleepy.
Okay.
So your disease, the moment I see the biopsy, I know we have a jackpot here. So that's where we told you that don't worry, you're probably never going to take chemo, nothing. All you need is just the lump needs to come out of your system. We need to check your nodes. You may need to take a bit of radiation and one tablet to suppress your hormones, and you're sorted forever. We are not able to honestly say that to each and every patient. Okay, so some of them, that diseases do tend to be a bit more. So we are euphemistic. We are never going to say something that's going to really shock the hell out of anybody, but it is our duty to ensure that some bit of the um truth reaches them. Okay, so if you would have had a 4 centimeter tumor, again, let's pretend, and it was a triple negative or something, then I would have said, okay, we have a battle on our hands. You are going to be fine, but we are going to give you chemo first. We are going to give you 16 cycles of chemo or 8 cycles, depending on what we give. We are going to give you immunotherapy. Then we are going to do your surgery. We are going to give you radiation, and then I'm going to give you immunotherapy for 1 full year. So this is what I'm going to say.
What is immunotherapy?
So it is a newer type of treatment that is given to patients who are ERP or HER2 negative. Basically, it's a type of medication that modifies our immune system to identify the cancer cells. Historically, cancer cells have had the ability to disguise themselves or make themselves invisible to our immunity, and that's why immunity is not able to
Attack
catch
them. Right.
So we are always dependent on outer medication, surgery, radiation, but our own army inside can't fight. So now new medications have been developed where one can sort of make them visible again, take away their stealth,
Okay.
so that your immunity fights again.
So
And this is just
is
the
this
simple.
like a tablet oral treatment?
These
or
are
what
all
is it?
injectables.
Injectables.
Yes, but they have been shown to improve cure rates in triple negative patients quite significantly.
Okay.
And that's why now it's becoming a standard of care in a certain proportion of those patients.
And what is hormone therapy?
So about 50% on an average of breast cancers, okay, in our country are controlled by a woman's own female hormones, estrogen and
Okay.
progesterone. So we always check for that in your biopsy.
Like I was ERPR
Positive,
positive.
estrogen receptor positive, progesterone receptor positive, which means your tumor developed 2 receptors on its surface, one for estrogen hormone and one for progesterone, and your own hormones were driving that. So all we need to do is just block your hormones by giving you some medication, so they go down. Now this receptor doesn't get its feed, so it doesn't make the cell grow, and the cell dies its natural death. That's the plan.
So that is where tamoxifen comes in.
Absolutely.
और tamoxifen के साइड इफेक्ट्स क्या होते हैं डॉक्टर?
थोड़े थोड़े होते हैं, बहुत ज़्यादा नहीं होते.
क्या होते हैं? बाल झड़ते हैं ना?
See, you are on an anti-estrogen. Your estrogen is what makes you a woman, right? So your hair is because of estrogen, your skin glow is because of your estrogen, everything is because of estrogen. But unfortunately, in your case, your cancer is because of your estrogen. So now we have to play a balancing act. So when I give you the tamoxifen, okay, the benefit that I am getting in terms of not allowing a cancer to come back and ensuring that you live healthily till 85 to 90 years of age is so much. And the potential side effects that I'm getting are so many. So I'm not saying our medication, not the surgery, nothing is without potential risks, okay? But you have to weigh the pros and cons. And if the pros significantly outweigh the cons, you have to know. My job is to make you understand, but you have to go with it. There is no other way out. So the known side effects of tamoxifen are, as it's blocking your hormones, you're going to get symptoms like menopause. So you're going to get hot flashes, mood swings, irritability. The body does tend to get adjusted to that over a period of few months to years. But yes, I have had a sizable number of patients who have really been through hell for many, many, many years. And my heart goes out to them. But then again, I again and again tell them, it's a way of just mollycoddling them. I tell them, see, इतना side effect हो रहा है, इसका मतलब आप में गोली बहुत अच्छा काम कर रही है. Okay, but that's the best I can do to ensure that they take it. Because if they stop taking it, the last thing I need is they come back to me with some bad sonographies or something bad. And
but
now
I know कि मुझे होता है. I get hot flashes also, and I get a lot of mood swings and irritability and depression.
correct.
And I think the person who's handling most of it is my husband.
Absolutely correct.
And I keep coming back to you saying tamoxifen band kar do, band kar do, band kar do, and you do this mollycoddling with me. I'm
With
one of
everybody.
those
I mean,
people.
again, the thing is, this is what happens. Familiarity breeds contempt. You can measure your side effects, but you are unable to measure the benefits.
Right.
Because your disease is out, and this disease is this medication is potentially avoiding a recurrence by taking care of some microscopic cells which you are not able to calculate or see on any scan. So generally this is what happens to most of our patients. Initially they are only thankful for all the medications and all, and come 5 years, 6 years, 7 years, and you are fighting at 2 years. So one should give you a lot of credit. But this happens generally at 5 years, is that मैं बंद करूँगी दवाई, ये दवाई की कोई ज़रूरत नहीं, डॉक मैं ठीक हूँ. Then I have to make them understand, आप गोली खाए हो इसलिए ठीक हो, बंद मत करो. 2 साल में you may not be like this. You might be also, but you may not be. And that time, God forbid, if the disease is back, it has come back as stage 4.
Right.
Then there is no point in crying over spilt milk. So accept.
It's already too late.
Yes. So it's accept now and try your best. If for whatever reason, I've had 1 or 2 patients in so many years who I eventually had to just stop the medication because they just couldn't deal with it. Okay. But then I explained and they said, Doc, I'll face whatever. But this is affecting my quality of life. But you have seen the number of patients we treat, right? I can tell you that I won't in this on, but I just know 2 names who stopped them. One at 6 years, which is ideally to be taken at up to 10 years, and one at 4 years.
Okay.
Both of them are fine. But the reason I am saying the denominator is huge is, 2 out of maybe 15,000 have stopped. Why am I saying this? Somebody watches this and they are on the fringe. They should not feel that I am endorsing that they can stop.
No, मैं तो एक बार डॉक्टर के पास ये भी बोलने गई थी, and I was very, very hopeful that I'm totally going to convince you this time. I think this was hardly 1 year ever since I was on tamoxifen. I said कि मैंने एक जीनोमिक कोई टेस्ट कराया है, उसमें मेरे अंदर तो कैंसर जीन ही नहीं है. तो एक बार हो गया, वो गलती से हो गया था. सेकंड टाइम तो चांस ही नहीं है. सो tamoxifen क्यों लूँ? मतलब माय जो क्या बोलते हैं, जो लॉयर की वो होती है ना, जो देते हैं, जो क्या बोलते हैं उसको, आर्ग्यूमेंट जो देते हैं, वो बिल्कुल सेट थी. बट यू वर सो स्ट्रॉन्ग दैट नो, इट्स एब्सोल्युटली नॉट. Next question.
We are not entertaining this
yeah,
question.
you just didn't. I was like so disappointed.
No, it's not. What you should understand is you made this argument on the basis of a certain logic, which was not backed up by scientific knowledge. Okay,
faith.
So
it was backed up by faith.
Faith is something and science is something else. We need a combination of both to get you better.
Yeah.
So we will listen to all your faiths and you will listen to all my science. That's how it works.
But talking about faith, I remember जब मैंने biopsy करवाई थी, I was told कि the report is going to take a week. And in exactly 2 days, my phone rings and your name flashes on it. And I was 100% sure that the report is going to be negative. I thought ये सब, we are just doing it to rule this out. And ये तो हो ही नहीं सकता. You know, एक हफ्ते में report आएगी और negative होगी. So obviously I was not expecting that phone call so soon. So there my faith shook a little bit. But I picked up the call and I knew कि तो बुरी खबर ही होगी. डॉक्टर मंदार नाडकर्णी का नाम क्यों मेरे फ़ोन पे सामने से क्यों फ्लैश हो रहा है? I'm the person who's supposed to chase him. And I picked up the call and I want to remind you that you did not use the word cancer even once during the conversation.
Mhm.
You kept saying, Chhavi, come and meet me. We'll fix it. And I said, Doctor, do I have cancer? You said, you don't worry about it. Just come and meet me and it's fine. Again, I asked you 3 times, but you did not use the word cancer. Eventually, the third time, you just said yes. I want to ask you, was there a reason behind not doing it? And how do you feel when you're breaking this news to somebody?
Okay, so when you break this news, as I see it, okay, as opposed to the West, where it is considered that it is just the patient's right and nobody else is right to know all of this. So in the US, if you're treating a patient, you have to tell the patient you have a cancer and you have to send all the relatives out, and then the patient will decide whether she wants to declare to the whole world or not.
Okay.
In our country, it's the other way around, and I have seen that right since the time I've been a resident doctor growing up, that the patients will come and the relatives will say, I know the report, इनको बताना नहीं.
Oh,
But कैसे बताए नहीं? I mean, the lady is your mother. She is 30 years older than you are. I mean, she knows. And the last thing she needs is somebody lying. And I always tell my patients, I said, don't make me lie to her. She is dependent on you and me to get her through this. And if at any point in time she feels we are not truthful with her,
who is
whom
she
is she
going to
going to depend
trust?
on?
Yeah.
Every night, okay, we are treating her, but every night she's thinking, ये मुझे बता नहीं रहे, मैं मरने वाली हूँ या मेरे साथ कुछ खराब होने वाला है. So she has to know the truth.
Yeah.
Okay, but the truth can be soft.
Yeah.
So I prefer to use the word tumor rather than a cancer. My treatment doesn't change, my outcome doesn't change. A patient probably also prefers to hear a word tumor rather than a cancer. They face the same treatment with a little bit of more positivity and a little bit of more or less fear. Let me put it that way. So, if I'm not even calling it a white lie, if I just euphemize my statements and if I'm using milder words, what's the harm? Okay, at some point in time, I do tell them once in a while, I will utter the word cancer. And if they're ready to accept it, and I'll say, yes, this is a tumor type of a cancer, but you have a good type of a cancer and you're going to be fine. So don't worry, just treat it.
So, I want to understand from you, बड़े सारे पेशेंट्स आपके पास तो आते हैं, दे आर आस्किंग सिमिलर काइंड ऑफ क्वेश्चंस, हज़ारों क्वेश्चंस आपसे पूछते होंगे, स्पेशली मेरे जैसा पेशेंट हो, मैंने तो आई थिंक आपका दिमाग बहुत खाया था, ऐसे क्यों नहीं,
ये सारे पेशेंट पूछते
सब करते हैं
most
ना.
of them.
So what is, how do you deal with that?
Honestly, in my mind now, I have an FAQ ready. So, say on a post-op day, I'll be very practically honest. When I go on a post-op day and I start talking to a patient and I start telling them one after the other, in my mind, I know there are 9 questions they want to. Now, there are people who want to ask the 10th and the 11th and the 12th also. And sometimes I enjoy it when some people will think of questions which are beyond my FAQ. And I really enjoy that round.
Creativity at play.
I mean, this person has done reading and is asking me really valid questions. But then sometimes you have uttered 2 sentences, then they'll try and stop you and ask you. I'll just say, let me finish. And so my 9 FAQs will be done, and then I say any questions, and 9 out of times they will say, "Nee, doctor, covered."
This was it.
Covered.
Achha.
Everything covered. So they ask us the same questions. They need to be told the same thing. I mean, just because the last 4 patients I said the same thing, the 5th is I can't say, "वो patient को पूछो please, अभी थक गया मैं." I can't do that. So I have to make them understand the whole thing all over again. But somewhere it becomes a well-oiled machine, and at the end of the day, let me put it honestly, doing a surgery is something great. I mean, because we are surgeons, we love it when something looks good. At the end of the day, we do a good job surgically. But a smile on somebody's face, I'm telling you, it's worth it. And when I say this, a smile on somebody's face, I'm not talking only in terms of a patient who has a cancer. And I used to even today tell all my students that I'll tell you something. You'll have a few patients, because now what has happened is that we are in a cancer department. Most of my patients will be cancer. But there'll be some who think they have cancer and have come, and I have to tell them you don't have it, and I have to send them back. Somebody has told them you require this surgery, and I have to say just go home. You don't require anything. Just stay at home. Okay? You should see the smile that is there on their face. It's like a lease of life.
Yeah.
It's like they have been all set, ready. They have come from Calcutta or wherever. today the doc is seeing me, tomorrow biopsy, परसों मेरा ऑपरेशन, फिर मेरे को ड्रेन, ये blah blah, chemo, this that, and now the doctor is saying, boss, I don't think you have anything, please go home and see me after 6 months. And it's like, oh my
Yeah, what
god.
a relief.
So that smile, I think all doctors work for that.
Also, like lot of times people take a second opinion. और हर डॉक्टर का आई थिंक ट्रीटमेंट थोड़ा अलग भी हो सकता है. आई मीन वट एवर कोर्स ऑफ ट्रीटमेंट यू डिसाइड, इट्स नॉट लाइक अ थंब रूल कि ये है तो ये है.
या मोर और लेस थंब रूल होना चाहिए, बिकॉज टू गेट optimum results which are uniform all over the world, there are guidelines that are made.
Okay.
And all of us have to follow those guidelines. Sometimes in situations which are not really black and white, we may use our minds, our knowledge, our experience, and discuss with the patient and tell the patient that what I am now suggesting is a bit off the, outside the guideline, but I think that's best for you. And this is where maybe two doctors may have a difference of opinion. But 99 out of 100 times, all doctors will probably say the same thing for the same disease.
So in my case, I had gone to this other doctor. मतलब मैंने दिखाया नहीं था, but I had spoken on the phone, and she had recommended a mastectomy, a full breast removal, and put an implant. Now her thing was कि अभी तो छोटा सा है ट्यूमर, बट रिलैप्स हो सकता है, बाद में कभी आ सकता है, तो वाई टेक दैट पॉसिबिलिटी और लीव दैट टू चांस, लेट्स जस्ट रिमूव द होल थिंग. इनफैक्ट शी रिकमेंडेड डबल मास्टेक्टमी कि अभी निकाल दो, बाद में कोई टेंशन ही नहीं है. बट देन आई केम टू यू एंड यू सेड दैट यू वर हॉरिफाइड व्हेन यू हर्ड दैट, एंड यू सेड इतने से ट्यूमर के लिए पूरी मास्टेक्टमी नहीं करनी है, you don't know, and you explained to me very nicely what is the importance of having a real breast and how the whole sensation is going to go away and a lot of other things. So कभी ऐसा होता है कि कोई पेशेंट आपके पास आकर आपके डायग्नोसिस को या ट्रीटमेंट को क्वेश्चन करता है कि ये गलत है?
Definitely. And it is their right technically. They will go for a second opinion. Some of them will be very apologetic when I explain the whole thing, and then they'll say, doc, you give us 3 days, don't mind, but we are going to take a second opinion on this. And I said, of course, it's a question of your life, don't take second, take a third and a fourth.
Yeah.
And I believe that everybody is going to say the same thing, because what I am saying is not something that I have invented. I just, this is my standard line for all my patients. Again, tagline, I said, at this moment I appear the most intelligent in this room is because I have read the book of the guideline.
Yeah.
Now, if I give it to you, all of you will be as equal. So you'll also know what you have to do for your relative. So do it. So they ask. So they are always going to take opinions. They take opinions, and it's fine. And once in a while, it does happen that I may say surgery, and somebody else may say, boss, I think we should take a few chemos before I do the surgery. Or I may say, I want to give chemo, and then they'll say that, no, I went to this person who's a senior doctor, and he said surgery is first, and why are you unnecessarily taking chemo? So then, instead of getting miffed, I'm going to say, see, you can do a surgery and do this. You can do a chemo first, and you can do this. My judgment tells me that in this case, I want chemotherapy. I'm not disputing what the other surgeon is saying. That is their thought process, and that is also not incorrect. But I feel if I shrink your tumor and make it smaller, because you're anyway going to require chemotherapy after, if I give it to you before and I shrink it, I'll need to take out only so much. So you'll have a much normal looking organ at the end of the treatment, okay, as compared to me doing surgery first. And that's the only reason I'm saying what I'm saying. Quite often they agree. Sometimes they feel that the other doctor is saying the right thing, so they get it treated elsewhere. But just because somebody else gave a different opinion, I can't change my opinion, because what I have given is what I have honestly thought is to the best of my judgment. So I have to give it.
Is it ever stressful
No.
that somebody else has said something else? Do you ever doubt
Initially,
your own
when you are
judgment?
junior, okay, so I'm now here in this hospital 16th year, okay, but
Okay.
initially when we were setting up a practice, and that is when you are very raw, and then somebody says something different, and the patient says, but आपने ऐसा बोला, वो डॉक्टर ऐसे बोल रहे, then you start getting a little flustered. You start thinking whether what I said was right or not. But I guess over a period of time you outgrow that, and you realize that this is right, is what is right. And I just think of it this way: either this patient is my sister, my mother, my aunt, my grandmother. What would I do for them? And what I think is right, I'm going to tell them. Now, if they feel that my suggestion is correct, they will get treated by me. If they feel somebody else gave them a better suggestion, fine. Everybody has the right to choose. So I don't get flustered by all this, but
And
initially we do.
have you ever encountered patients who are really impatient?
Yes, quite often.
तो कैसे उनको
Sometimes they
कैसे
can be
handle?
combative.
अच्छा.
But put yours, I mean, what am I telling you? I mean, I can put myself in their shoes and see. Sometimes the relatives are combative. Patients generally are not, because they are already struggling in their minds. It is sometimes the relatives who are
Like, can you
restless.
give me an example?
In terms of how combative?
Yeah.
Oh, first is if you make them wait. Say, doc, you called me at 10 o'clock.
Okay.
It's 10:45. We are
Achha.
stressed out. Okay, how can this, blah, 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 whatever. Something happens, you send a patient somewhere, you send for a biopsy. Now the biopsy report, they are delaying it. Why are you not talking to them? Okay, doc, we have come from so far. 3 days we have waited. So at the end of the day, you're speaking to a relative who's going through hell of emotions with his wife or his sister or his mother or his somebody, daughter. Sometimes you have to absorb it. So you just have to let it go. I said, okay, I'll do my best. You just hang in there. Okay, do my best. And then they also realize that, okay, they have vented it. Then they realize, ये भी क्या करेगा? पैथोलॉजिस्ट, आई मीन बायोप्सी होनी है, बायोप्सी में एडिशनल टेस्ट करने की ज़रूरत पड़ रही है, तो पैथोलॉजिस्ट उसको किए बगैर तो रिपोर्ट देंगे नहीं. हाफ रिपोर्ट कैसे देंगे?
उन्हीं का नुकसान है अगर हाफ रिपोर्ट आएगी तो.
But at that moment, sometimes they do get a bit upset. But these are rare things. Most Indian patients are brilliant, I can tell you.
अच्छा, बट एक जनरल एक परसेप्शन होता है कि डॉक्टर जितना सीनियर है उतना ज़्यादा टाइम उससे अपॉइंटमेंट लेने में लगता है, और अगर आप जाते भी हो तो उतना वेटिंग होता है. सो पीपल स्टार्ट फीलिंग कि शायद एटीट्यूड है डॉक्टर में, मिल क्यों नहीं रहा है, ये क्या बात हुई, हमें कैंसर है, हमें इतनी बड़ी बीमारी है, डॉक्टर के पास टाइम नहीं है. आप प्लीज़ बताइए अपना पर्सपेक्टिव, क्यों ऐसा होता है, वेयर डू यू कम फ्रॉम?
As the amount of work increases, okay, there are only 24 hours. Okay. And you can't possibly work from 7 in the morning till 11 in the night. So you try to cram up all the work in a certain amount of time, beyond which you need some time for yourself and your family to remain sane. And then it does so happen that you can't, sort of, if otherwise you would have spoken, say, 5 years earlier for 5 minutes with that patient, here you probably finish within 2.5 minutes. And you are getting restless because, your secretary has just shown you the list that there are 7-8 patients more waiting. This does tend to happen, I'll be honest. But again, like I said, so then I thought to myself and I said, what best that I can do? So I said, generally these patients have these questions when they come. So now I'm again on my FAQ thing. So when I start talking, what I would have chit-chatted over 5 minutes, I deliver as a didactic talk with FAQs answered in 2.5 minutes.
Making the most of the time that you spend with them.
Yeah, so whatever you need to know, I'm giving you fast. But yes, I'm not giving you time. I'm not saying that is correct. But what can I do?
No, but exactly. I mean, even people who are busy in other fields, when you have a certain amount of workload, okay, you have to learn how to manage your time and how to make sure that your workload is finished. Now, it is important that doctors have to spend an X number of minutes with every patient, but it is also important that you have to see all of them.
Correct.
So that is a tough choice कि मैं सबको देखूं या किसी को लेट तक बिठा के रखूं या सबको equal amount of time देकर. I mean, that cannot be an easy choice.
And the second thing that happens is, we then sort of pick and choose. There is this person needs more of my attention. Now, if they take 15 minutes, so be it. Because, this is an old patient who's treated and she's got a relapse. Now, you can't just say, this is going to be your treatment. Now, she needs 15 minutes of your time for her to absorb everything and talk. So that's where you are going to give your 15 minutes. And then the other situations where the patient otherwise is hale and hearty, all reports are hale and hearty, you will probably finish them in 3 minutes instead of 15 minutes and try and catch up your time there. So yeah, we do that also.
I also want to understand what a doctor goes through when you meet a patient who's really emotional and crying and devastated. I mean, I'm sure it must be impacting you at certain level because you're meeting like patients with the deadliest of disease आजकल the C word means people are scared of it.
No, it bothers us. There is no doubt about it. I mean, you can't even imagine, a young family, a 45-year-old lady, two young kids, and the standard thing is talk, do something. I've got two young kids.
Yeah.
रेस्ट और कुछ नहीं, मुझे कुछ नहीं चाहिए, हस्बैंड को कुछ नहीं चाहिए,
Hmm.
बट ये बच्चे छोटे हैं, उनको बड़ा होने दो, गिव मी सम टाइम टिल देन. आई मीन, these are heartbreaking things that we hear. The only positive, like I told you some time ago, is that I treat breast and colorectal cancers, and both of these have very good treatments available even in advanced cases. And more often than not, we are able to grant them what they ask for.
Hmm.
Okay, may not be a permanent cure for some of them, but at least they get good many years with a good quality of life, by which time they can organize their lives, to a certain extent.
Hmm. Oh my God, it must be so tough to know that okay, I have these many years left, and now I have to do everything in these many years. I mean, kind of like a doctor deciding I have these many hours left, and I have to cure these
and
many
and nobody
patients.
know and nobody knows how many hours you have left, how many days you have left, or months
Yeah.
or years, because they ask us, some of them are so brave, they'll ask us, doc, tell me, how
Hmm.
much time do I have? We don't have an answer.
Hmm.
So it's like, just treat. Let's see your next scan. If your next scan is very good, then you have lots of time. If your next scan is not good,
Hmm.
then I'll try my best to answer this question. Please don't ask me this question today.
But I think you're one of the most positive doctors that I've interacted with. And every time that I've met you, you've always been very positive, very calm, and very patient. And I think I've been the impatient one, although I'm the patient, but you're the patient. I wanted to also ask you that why did you choose like this cancer, I mean, as your specialty
Mm.
out of all the things?
So I belong to a family of doctors, and my father is a surgeon, and my mother is an anesthetist, and my wife is an anesthetist, and it's all in the family.
Mm.
So my father he's not doesn't practice anymore. He stopped practice, but he is a retired general surgeon and he used to do urological work. And I always grew up thinking that one fine day I'm going to walk in his shoes.
Mm.
And as I was growing up, two things happened. One is, I felt that we used to see in our general hospitals that we used to treat the general surgical patients pretty well. And
Mm.
when cancer patients came, some of the better senior surgeons also used to struggle. And the basic simple reason was nobody was trained.
Okay.
Okay. And I was born and brought up and living in a city where the biggest cancer training center was Tata Memorial Center.
Mm.
So my somewhere in my mind, by the time I reached my second year of surgery, I had promised myself that I'm going to spend some time in that institute, get a good training for cancer, and then start doing what my dad does. But if I ever get a cancer patient, I will be able to do justice to the patient and
Mm.
do a proper surgery and proper treatment for that patient.
Mm.
Never at that moment had I ever imagined that I will become a cancer specialist and forget one organ specialist, because that evolves over a period of time.
Okay.
But this is what had happened. The second thing which really pushed me was when I was doing my residency, I was very close to my maternal grandfather,
Mm.
my mom's dad,
Mm.
very, very close. And he was blind for the last 15 years or 20 years of his life because of glaucoma.
Okay.
But he was a very wise person, very wisely invested in shares, self-made person, because his parents passed away when he was about 2-3 years of age, and he was brought up by one kaka or one bua or
Mm.
something, like that's how the
Okay.
children come up. And he reached very high levels in his professional career and brought up 5 kids. So I was a total fan of his, and my grandmother, maternal side actually. And he got a cancer of the colon,
Oh.
and colon near the rectum. And he was 85 years of age, and he underwent a surgery. And unfortunately, about 10-11 days after the surgery, he died. He didn't come through the surgery. He had a
Oh.
complication and he died. And that is where I realized that I have to learn this, because somewhere I felt it could have been done better.
Oh. So that's
No,
what
I mean, it was.
motivated. Yeah.
I'm not saying the person who treated him was not trained. The person was trained, but that is where I promised myself I am going to do cancer. There is no question. 3 years in Tata Memorial is a given. Beyond that, I don't know what's going to happen to me. And then I don't know. It just moved in a certain direction.
But I'm glad you're in this because you saved my life.
You're welcome.
But you have a lot of Ganpati idols in your where you work, in your hospital, in your room. What is the story behind that? And I have noticed you that you, before you write a prescription or something, you always...
Okay, I'm a very religious person. Okay, so I totally believe. Okay, like we just now discussed, I have never planned my life. My life has been planned for me. My parents didn't do it. Somebody did it. Some people call it luck. Some people call it fate. I call it God.
Okay.
Everybody to their own. So I have strong beliefs. Okay, nothing is going to shake them. Okay, so I do believe there is a power over me and over everybody. Simple thing, I'm treating a cancer. For a certain stage of cancer, 80% of patients are going to be fine. And the remaining 20 are going to take the same treatment and not going to be fine. They're going to get the disease back. How do you explain that? Everybody took the same disease, all of them had the same report. Why did 20 get it back? So we call it, these patients had aggressive disease. They had some resistant tumor, so they didn't respond well to chemo. All these things. Finally, what does it mean? That there is a power over me and that patient which decides the outcome. So then we can say aggressive tumor biology. You can call it luck of the patient, fate of the patient, taqdeer, naseeb. I call it God. So I always tell my patients, I'm going to pray 5 minutes for you. You have to pray 5 minutes for yourself. But we have to do the treatment perfectly.
Yeah.
And after that, you have to tell God, God 80 में डाल दिया, I'm going to say thank you. 20 में डाल दिया तो भी I'm going to say thank you. But I'm going to do my best. Because beyond this, we can't do anything. So that's where my strong belief comes from. But the Ganpatis on the table actually come thanks to my boss, my ex-boss. So I have learned everything that I did in breast surgery from my boss, Dr. Badwe, who was the ex-director of Tata Memorial Center, and even today he's the head surgeon for breast cancer in that organization. Brilliant organization and brilliant boss. And he used to have small Ganesha idols on his table. So I was a copycat.
Okay.
So when I joined as the junior consultant under him, and I worked under him for 5 years before I moved to this, because this gave me the chance to be ahead of the service. But so on my table out there, it's like dad sits like this, the bacha also sits like that. It's like my boss had Ganpati, so I also had 5 Ganpatis. He had 40, maybe 30. But then those Ganpatis also I moved to my office. Then patients started probably thinking he likes this. So they gave more. So
अभी कितने का count किया? कितने हो गए?
About all 3 rooms put together, I must be having close to 700-800. I don't know how many. And unopened maybe another 100.
And they are some of the best pieces. I mean, I haven't seen most of them. All different.
So who gets the credit for that? The patients. They come. When they are waiting for me, when I'm in the other room seeing a patient, they take their phones and they take pictures. And now they go out and hunt, and they open this and they see, is there a similar Ganpati there or not? And they will find out and get a Ganpati which is different.
Oh, wow.
So I remember one page, you know, in my main office where you sit, there is a Ganesha where he's lying down and then there is a mouse who's reading from the book. The main one,
yes,
right?
Yes.
The one who I always do this to.
Yeah.
Okay, pray before I touch anybody's report or file.
Yes.
That same one. So that was given to me by a Parsi patient. Okay. And one fine day I'm seeing a patient and she calls him and said, Doc, I am XYZ speaking. I said, yeah, tell me, what happened? She said, Doc, don't get angry with me. I actually am in Sadhguru's at here. And I've found this brilliant Ganesha who's lying on his tummy. And then there's the mouse who's... Doc, do you have one like that? I said, no, I don't. Okay, thank you. I'm hanging up, Doc. Within 2 hours, she was there with the gift.
Oh.
And so I think the credit to having so many different Ganeshas goes to all the patients who take real time out to check whether I have similar ones or not. And then they somehow find something that I don't have. Yeah. And then they give it to me.
I'm amazed that so many different idols exist in the world.
Absolutely.
I mean, you have so much
creativity.
variety.
Human creativity is unbelievable.
Yeah. And another interesting thing that I remember that the first time or the second time when I'd come and met you when we were discussing my case at length कि क्या करेंगे, what are the next steps, तो आपने मेरे को बोला कि Chhavi, what did you do? Where did you write about this? I'm getting calls from everywhere. Are you Chhavi's doctor? Are you Chhavi's doctor? And you were very superstitious कि क्यों अभी क्यों बता दिया
Yeah, I don't
social
like
media
that.
में. I'm sorry about that. But आपने खुद कभी नहीं सोचा कि अपना भी एक Instagram account होना चाहिए?
No. This
क्यों
is
ऐसा?
not. No.
So many doctors do
No,
that.
like I told you, I don't. Years and years have taught me that somebody is writing my future for me. I whenever I try to do something on my own, I succeed, but it's not that I may always succeed. And then I may hit a roadblock, and something then great comes 6 months later. So I have learned one thing, that I am one of those people who has to flow with the tide. There is a God who is doing things for me. I am not the one. I just do my bit.
You are not for show off.
No, I don't like all these things, and I am very superstitious. That's why I think you wanted to post a picture, and I said don't post a picture.
Yeah.
So there are so many patients who have ports for chemotherapy, and then they say, "Doc, abhi nikalo."
Yeah.
So very early on in my career, I had one or two patients who came and insisted, "Abhi chemo ho gaya, abhi nikalo." मुझे अभी निकालना है कल. मैं बोला रखो ना 6 महीने. नहीं निकालो. So I must have done that for 6, 7, 8 people, but 2 of them got a recurrence within 2 years. Okay. They would have probably got it because, like I said, 20 out of 100 are going to get a recurrence, right? But that has stuck in my brain. So I tell all my patients when they come and say, "Doc, abhi 1 saal ho gaya, 6 months ho gaye, nikal dete hai na port." I said, "You really want to take it out?" "No, what do you say?" I said, "I would like you to keep it for 6 more months. 1 year later, after radiation, we'll take out. Are you comfortable with that?" "But if I don't need it, doc, why are we keeping it?" So I tell them very honestly. I said, "I promise this is superstition. This is not science." And I tell them this story. And I tell them, I do believe deep in my heart that we should keep it for 6 months. You'll be safer. I may be completely wrong. This is superstition. But I believe it. So I'm saying it. If you were my own sister, I would not taken it out for 6 months. So I'm telling you. And they all will agree. And they'll say, "Doc, I am waiting. I go with your superstition."
Correct. I mean, it's easier to convince that way rather than...
No, but that's the only... But that's the truth. Honest truth. Because it is superstition. I can take it out in 6 months. But those 1 or 2 patients are etched in my brain. So I just tell them. If somebody insists, I take it on. And remember, for those 7, 8 that I took out, 2 got a recurrence. The others didn't. But then,
ठीक है.
I'm superstitious.
कुछ superstition, I mean, we should respect. हाँ.
Yeah, so I have to touch that Ganpati and then touch the report. I have to do it. I can't stop it.
Okay, tell me any case that was your worst case, like ये बहुत मुश्किल था लेकिन सब अच्छा हो गया. Any surgery, that's any kind of complication that you faced and you thought on the spot, on your feet, or any kind of case which you really had to
breast surgery में इतना होता नहीं है.
नहीं होता है.
मतलब I may need to really dig in deep and give you some fake fancy story and flex my biceps.
Give now fake fancy story.
There's nothing. Breast surgery is easy. Breast surgery is nice. It's very forgiving. It's very gratifying because if you get a good cosmetic outcome, you only feel good that you've done a good job. And we really don't hit these kind of bad situations. We don't.
Okay.
Bad situations we sometimes get as part of tumor biology. Like I remember this young lady 2 years into my practice in Kokilaben only. Some lady from Andheri. And while I operated on her, everything went off well. Chemotherapy was going on. And while she was on her 5th chemotherapy, she got brain disease.
Oh.
So her disease spread so fast. And I remember her husband, her son in tears. Yeah, so these are few things etched.
But that's a tough profession thing, no? I mean, as a doctor,
it bugs you.
For people like me, for patients, it's just us. It's just me. It's just one. I'm one. My journey is one. But you go through with patients. I mean, you go through so many journeys with them.
No, but to be very honest, we have the ability to switch off. So, you come, I talk to you, you move. Now my mind is, unless there is something grossly wrong that has happened in your case, then that's going to linger. But if everything is fine, okay, then I'm looking at somebody else's report and now I'm 100% with them.
Right.
And then they are out and I'm 0% with them and now I'm 100% with the next one. So we have the ability to toggle on and off and on and off.
So this ability to toggle, do you also use it at home with your wife? Or is there a reason why doctors marry doctors?
We marry doctors for two reasons. One is we work in the same place, so proximity. So you meet each other.
And you don't meet anybody else.
That is the bigger reason. That's the reason. These are the two reasons. We
So-
don't have time to go anywhere else and meet anybody else.
So I've often wondered, what do doctor couples fight about?
Fight what everybody else fights about.
Same things.
Khana, pina, vacations,
It's so hard to imagine.
diamonds.
Okay. Now, before we end the chat, tell me what are the things to be avoided? Can breast cancer be avoided, or if you have, I mean, what are the things? What are the best practices?
Okay. So no cancer can be avoided. Okay, but you can definitely reduce your risk of getting a cancer.
Like a lot
Breast
of people
cancer.
nowadays say कि microwave मत use करो, non-stick pan मत use करो, mobiles मत use करो, Wi-Fi मत use करो, plastics मत use करो, packaged खाना मत खाओ, packaged खाना मत खाओ. I mean, can we really avoid all these things and cancer can be avoided?
No. First is that, and two is these are all hearsay. You know, so there is no proof. Nobody has been able to do a conclusive study which has proved that any one of these that you mentioned has been conclusively proven to be
Right.
associated with an increased risk of cancer. So these are just sort of observational things that people have कि मेरी नानी थी तभी मोबाइल फ़ोन नहीं थे, माइक्रोवेव नहीं थे, उनको कहाँ कैंसर होता था. ओके, हमारे पास ये सब आ गया तो होता है. बट उसके साथ मल्टीपल अदर थिंग्स हैव ऑल्सो हैपेंड. प्रोसेस फूड्स, नानी फिट होती थी, सिंपल खाना खाती थी, हम चॉकलेट खाते हैं, शराब पीते हैं, बटर चिकन खाते हैं, or whatever. I mean, fatty foods. So what one has to understand is what are the available data at the moment which point towards an increased risk of getting a cancer, of breast cancer. Let's talk about breast cancer because today we are on that topic. So a woman who starts her menses very early and then stops her periods late after about 55.
Okay.
These are women who are at a higher risk.
Okay.
But you can't modify that, right?
Yeah.
Because that's your biological clock.
Right.
But a woman who does not have her first child, okay, or let me put it this way, has her first child a bit late, does not breastfeed her children, or does not have children at all, is at a higher risk of getting breast cancer.
Okay.
Now, this is in some way controllable. A woman whose body mass index is high, especially when she crosses the age of 50, her risk of cancer is high. Higher consumption of fats, higher consumption of carbs, higher consumption of alcohol, increased risk of breast cancer. Okay, all these are there. To understand how you can reduce your risk, you have to look within the country. So if you look at the urban part of India, okay, say Mumbai and all, let me put it this way. In India, the lifetime risk of getting breast cancer is 1 in 25 women. The same risk is 1 in 8 women in the US.
Okay.
Okay, so we are 1 in 25. So our risk is not as high as the Western world. But within our country, if you look at urban, women who live in Mumbai, Calcutta, Delhi will have probably a risk in 1 in 18 to 1 in 20. And those who are living in smaller towns or villages are going to have 1 in 40 or 1 in 45, 1 in 50.
Okay.
Now, how come in the same country you have a different, rate? So this is what actually gives you the answer. A woman who lives in Mumbai should try and make herself live like a woman who lives in a village. So what does that woman do in a village? She wakes up early. She gets up. She maybe cooks a simple meal for the family, and that's the simple meal she's going to eat. She, when the family is waking up, she packs off the tiffins and all, sends the kids away, sends the husband to the farm. Then she probably cleans the whole house herself.
So activity.
Fills water, lot of physical activity. Then she goes again into the field, helps her husband, physical activity. Eats a simple meal, no fatty foods, no alcohol, nothing. She's probably very skinny and fit, no fat. Okay.
Correct.
So what you should understand is try and emulate. She has probably her children born when she was 21 years of age. She has no access to Nestlé and Cerelac, so she breastfeeds a baby for 1 to 2 years. Has her second one by 23. She hopefully stops by 25 with 2 children, but both breastfed for 2 years. Now you look at the urban woman. She educates herself, and I've got nothing against that.
Right,
Okay,
true.
but I'm just very dispassionately comparing. She educates herself. She can't, sort of get into a relationship which can sort of, interfere in her life, or at least in her career goals. She gets married late. She probably has children late. She probably does not breastfeed them as long as
Yeah.
she should ideally, or
Mm.
do as per scientific requirements.
Mm.
Fatty foods, alcohol, lack of
Mm.
exercise. So she's doing exactly the opposite of what this lady is doing there. And
Mm.
this lady is 1 in 45. This lady is 1 in 18. And if you want to become like Taylor Swift, I should not say that. I mean, if you want to be super westernized, okay, 1 in 8. That's where we are
Mm.
hurtling. So
Oh.
a woman should dress like the Western woman, but in habits try and be like the
Mm.
rural Indian woman, and automatically our rates are going to come down.
Thank you so much, Doctor. That was a beautiful way to end the conversation today. I hope you guys had a lot of takeaways from this conversation. And like Doctor puts it, the simpler you live, the simpler your ailments are also. The more complicated your lifestyle is, the more complicated diseases you are susceptible to. So keep it simple, do your checkups regularly, exercise regularly, eat well, and be positive. That's all I can say. I think my positivity helped me a lot through this. And once again, before ending this, I'm going to reiterate that it was a lot because of Dr. Mandar's positivity and because of his assurance that everything is going to be okay, everything is under control. Please remember to subscribe, and I'll be back next time with another guest in another episode of Silver Linings. This is me signing out. Love and peace from